Welcome to Doctor in the House. Dr. Babasana joins us every midday, every Thursday, to take us through that journey of health and safety. So, Doctor, after yesterday's, last week's short break, we're back on Doctor in the House. Thank you for joining us, Doctor. Good to have you.
Yes, fellow countrymen. Let's go.
The trend of fellow countrymen is coming.
Let's just keep being fellow countrymen.
Yes.
Fellow countrymen, we are doing well.
Okay.
We are doing very well.
Okay, so Doctor, we've ended the reproductive health series.
Yeah.
So what are we doing today? Responsible drug use.
Yes. You see, I had something else entirely in mind, and last week I saw a link that there was a university. I will not mention names. There was a university who claimed that they had discovered, or they had invented a drug that could cure diabetes and cure prostate enlargement.
And a university
in Nigeria.
Researchers there.
And
they would have done their research.
And they had been given approval. They had been given approval by NAFDAC. It was on publication. I think yesterday or day before yesterday, NAFDAC had come out to deny or to debunk that allegation. But beyond the rhetorics, beyond that rhetorics, the NAFDAC story is they were supposed to get, there was supposed to be a list, and then there was supposed to be the approval. That the approval that they gave them had expired in 2019, and then for them to get a new approval, it was just a whole. Beyond all those rhetorics, if you are bringing drugs into the market anywhere in the world, there are some things that we call clinical trials. Clinical trials are the researches that are done to discover the safety of the drug, the long effect, the toxicity profile, the dosing of the drug, and then finally, does the drug have any side effect, any long-standing effect, any issues at all? And I give you an example. In the 50s and 60s, there was a wonder drug for pregnant women. The drug name was thalidomide. Now, a lot of pregnant women vomited because of pregnancy, as a first trimester pregnancy. This thalidomide was a very good
to stop the vomiting.
Just saying, you will not vomit. It was a wonder drug. And because it was that wonderful, the FDA rushed
the approval.
That's in America.
Yeah, I know FDA. Yes.
So they rushed the approval. So the approval was given to thalidomide. And then researchers started noticing
side effects.
Babies come without their arms, without legs, with deformed arms, with unformed legs, limbs generally, led by the late Professor Oluwambe Bashir in biochemistry of University of Ibadan here. They were able to bring out a proof that this drug is directly linked to this side effects. So the approval was withdrawn, and then more studies were done. The drug is not in the market now because the approval has not been reissued. Although there are some people that are using the drug somewhere. So, you see, this is a drug that has gone through all the. So when they said, there's a drug that has been done by this university, it can cure. But somebody called me. That means that I said there is no drug that can cure diabetes now. What is it that you're talking about? So I went online to search and I saw it. And then, of course, as a clinician, I then went to the part of the internet where journals are kept, academic publications. So I searched there for the drug, for the clinical trials, and there was none. And I said, how could NAFDAC have given a license without a clinical trial? There are like 4 clinical trials.
But thankfully, NAFDAC debunked the report.
Well, my fear is that they said they gave the license, sometimes it expired.
Oh.
So that's the problem. Like, that's expired.
Okay. So that was why you decided to.
Yes, I said, okay, so let's talk about responsible drug use across board. For the people on the street, for the government, for the parastatals agencies of government. What does it mean? So when a drug comes out, when any drug comes out, usually we observe nature. The people that were called scientists in those days were mostly philosophers and natural observers. They just look at what is happening. The commonest illness in Nigeria is
malaria.
Yeah, malaria. You can be a doctor. The commonest illness in this country is malaria. It is malaria. The drug that we were using to treat malaria before was chloroquine.
Yeah.
How did we get chloroquine? We saw our forefathers using chloroquine. Same thing in Europe. Same thing in the Arabian Peninsula. Quinine was the first drug that they were using because there's a quinine thing. So, in fact, it is on record that when King Richard of Lionheart went to the Crusades in Jerusalem and he was sick, that Saladin gave him his physicians to treat him, because he knew at that time that there's a drug that they use to cure diseases that make people feel hot. In those days in Europe, in the Dark Ages, if you are hot, they will cut a hole inside you to allow the dark humor to escape. That was the treatment. It's not hard. That's medicine. We've come a long way. So that's what they did. But the Arabians, they knew that particular thing is caused by this is what we use. So they gave him that drug. In this part of the world, we knew. So when the English people came here, they met us using it. They took it back. They went to South America. They saw that they had a lot of malaria. They took the drugs from there. They came. Gradually, chloroquine was discovered from the plants. Now, you need plants to develop chloroquine. The moment they did that, chloroquine got approval, they realized that they had to produce it artificially. So they went to the laboratory. Can we synthesize it without the
plant?
So because economic forces. Because whoever had chloroquine, you can imagine the whole world is going to be using chloroquine for malaria. It's just money. So the Oyinbos like, no, we are not stupid. So we went to the lab. They developed chloroquine artificially. And they started selling it. We started buying it. Chloroquine was discovered in the 30s. Approval was given in the 40s. It took like 15 years for them to go through. I'm talking about 1930, 1940. They went through the trials. They discovered that these are this, these are that, these are that. They started giving chloroquine for malaria. And people started taking chloroquine. Now, irresponsible usage came. Now, they will not diagnose that you have malaria. You just think you have malaria. You're going to take chloroquine. It's cheap now. So the first thing that we have in Nigeria is that pattern. And that pattern is sustained by some other key factors. One,
the pharmacy.
Yes. And the laboratory people. Private pharmaceuticals and all those ones. If you're sick, you don't, in Europe and America, if you're sick and you go to any pharmacy, apart from what they call over-the-counter drugs, which are the vitamin Bs, the multivitamins and all those ones, you cannot buy any major drug without a prescription. In Nigeria, not only will you not have a prescription, you don't even know what is wrong with you. You go to the pharmacy shop, you say, but my body has been feeling one kind.
When last did you treat malaria?
They say, then they give you the drug for malaria.
Artemether and lumefantrine.
After that, they give you typhoid. After that, they give you another malaria. Then they give you more paracetamol.
Antibiotics.
Then they give you antibiotics. And then if that does not work, then they ask you to go to the doctor. And that's my problem. We are reinforcing irresponsible drug use.
So that is drug use without prescription?
It is irresponsible. Because you don't know. You see, one of the commonest causes of headache is malaria. Malaria brings headache.
Except you have hypertension.
Tumor in the head brings headache. Hypertension brings headache. Jaw pain brings headache. Ear pain gets headache.
Any tooth-related issue?
Headache. Yeah. Eye pain, headache. Stress, normal everyday stress, headache. Anxiety, headache. Hunger, headache. Poor sleep, headache. I have mentioned like 10 pathologies that are not linked.
And I think there was a time we discussed the part of the head that is
that
aching
each
you,
one that you
what it
need to be
stands for. I
specific.
think yes. We
The
discussed it
only
before.
headache that might be a symptom and a disease is migraine. It has other symptoms, but I mean, you can argue it like that to say, okay, that's a headache. Now that one is not even the normal. But if somebody comes on air and says if symptoms persist after 3 days,
Consult a doctor.
you have hypertension. It is bad. Severe hypertension. You took paracetamol today. You took tomorrow. You may not get to take the third day. I have a very junior colleague of mine, not a doctor, junior colleague of mine, who died like that. Had hypertension. But when I was conceptualizing this program, that was the person
that came to mind.
Yes, because he died like that. He had headache. He went to buy whatever they were announcing on the radio. He took the first day, 222. Took the second day, 22. He said, "It's nothing." He was somewhere on the third day, and somebody was arguing about something, and he was saying that guy was giving wrong information. So he stood up from where he was, and I was like, "That thing that you are saying, those were the words that he said last."
Just collapsed.
He didn't even finish the thought that was in his mind. That thing that you are saying, and he just went down, slumped. They took him to UCH. He died. Then we now realized that it was bad hypertension that he had. The vessels had ruptured in his head,
and he didn't even know.
He didn't know. It was treating headache. It is a doctor that will say, "Okay, you have headache." We will then begin to look for what the kind of headaches are. Doctor will clerk. He will take history. Doctor will examine. Doctor will order for tests. These days, I am feeling one kind. I go to the laboratory myself. I'm not a doctor. I go to the laboratory myself. I'm feeling one kind. So the laboratory person will say, "Let me test you. Possibly you have malaria." Who says that lady is not pregnant? Who says? Who says that it's not even something that you are not even thinking about?
So, headache, whatever feeling you're having, go to the doctor
first. See a doctor. You see, if don't take the drug, we should change the format that the drugs are being used for adverts on our radio. To read before taking this drug, consult your physician. Yeah. Consult your doctor. Not if symptoms persist after 3 days. 3 days is a very long period for very bad things to happen. And bad things do happen. Unfortunately, once it happens, it happens. Nobody will go on air. I mean, for me to come on air.
But they still say the Nigeria endorses this.
Nigerian Medical Association can endorse Dettol.
Yes.
For using cleaning things. You rarely see us endorsing drugs per se.
Or maybe toothpaste. Yeah, I know they do.
The Association endorse toothpaste for use. Whatever code toothpaste that they endorse, they will endorse it for you because they will have gone through some of the stuff. They're like, okay, this one is okay. Then they can say, okay. Some societies in medicine and in surgery will endorse something because it directly aids their practice. So they're like, okay, we are using this as a standard of what we are going to be using. I mean, the orthopedic will say crepe bandage is to be used as that kind of thing, and this is that's what they will do. Yes, but we will not come on air and say take the drug without. The only drug that we ask you to take without prescription is food, and we always ask you eat it moderately. Food is a drug because everything that is inside it can be formulated as a drug. Water is drug. The air that you are breathing in is drug. If you want to doubt, go to ICU and UCH now. Somebody is paying, I don't know how many thousand for a cylinder of oxygen. That's the drug that they are giving.
So you can survive the next day.
To keep him alive. It's a drug. The fact that you are doing yours free of charge does not mean that we have removed the father. So everything that we do, water is it. We can prescribe water therapy for you.
Every time doctor comes here, it gives you you start to look at life from a different angle. Seriously, doctor.
So those are drugs. If you are sick, do not. You see, I'm even talking about. You see, now let me say there are some doctors, and I do not understand why that happens. Maybe it's because of poverty of the mind. It's really because I'm not sure a doctor should have poverty in the pocket. It's only poverty of the mind. Now, you take a delivery of a baby from a pregnant woman. The entire world, scientifically, some things rarely happen. This is one of those things that rarely happen. That the entire world, including China and America, sitting at the same table, agreed that breast milk is the best for the baby. Okay, exclusive breast milk. So you, young doctor, took this delivery. Woman is going home. What do? The woman will come to you. Doctor, you have not given me all the multivite, and then you give them antibiotics. You give them paracetamol. You give them, I don't want to mention the name of paracetamol, but it's very common.
Yes.
You give all of that to them. You sell it because you don't give it free. You sell it. Now, if you don't give it to them, that woman believes that you don't know what you are doing, so she goes somewhere else. You want to sell your drugs, and that has created an industry. If you go to and look for where they do all the major hospitals where they do all these deliveries, you see all those drugs that I've mentioned. They are there. They are there.
They even write it for you too.
Yes, then you buy the right. A doctor comes, he presents to a doctor, it is just malaria. You've done the test. Every doctor, the World Health Organization says, for you to treat malaria, you must test, you must treat, and then you must test again. You tested the thing, you see that it's only malaria. There is no problem in the full blood count. It's just malaria that the guy has. Give him anti-malaria.
You say go and do full blood count.
You tell him do full blood count, because if I ask you to do malaria and it's positive, I cannot say whether the malaria is coming with an infection. Do you have infection secondary as an addendum? If I do a full blood count and there is no problem in your full blood count, it means that you are not having infection in any way of your body. Your blood is what tells us whether something is wrong with any part of your body. So we give you anti-malaria. But you will see these guys, it will be to write, so some doctors want to write 10 drugs for you to prove that they know what they are doing and to extort you. So the doctor now starts to write. So, anti-malaria, antipyretic, antibiotics.
And then so you can buy from the pharmacy as well.
And they get them more money. No, that's bad practice. Because the antibiotics that you are prescribing without need, you are just creating resistance to that antibiotics down the line. You are just kicking the can down the line. So it is an irresponsible drug. It is very common among doctors. Very common. And that's one of the reasons why I say we will speak to that here so that we can clear the air. If you are in front of your doctor, please, if he gives you any drug, it is your right to ask the doctor, what does this one do? If he says to treat infection, ask him, do you have infection? If you don't have infection, why are you treating the infection? Are you treating it in lieu of when I'm going to have it? Because the drugs don't stay like that. So treat what the person has. Wait for him to have the infection before we treat. That's responsible. The other ones that we're doing, I'm not even talking about the ones that go to quacks. Those ones are beyond the scope of this program. We cannot do 30 minutes is not enough. Quackery. If something that is we will consider it in medical practice to be similar to murder one. In America, murder one is when you kill somebody with intention. First degree murder. You plan, you strategize, and then you executed him. Murder one. If something is akin to murder one, it is quackery. Because you that you are seeing the patient, you know that you are not a doctor. You know that you will not treat that case. You know that if your family has that problem, you will not be the one to do the treatment. You will take the person to, but when this guy comes, he will sit down in front of you. You will smile. You will roll on your chair with your stupid white coat. And then you will say, you should go and do, and then he will go and do because he trusts that you are a doctor. That's criminal. Anybody that is caught, in fact, in Ogun State, they're doing a very good work. They're putting them to jail. They put them in jail. The quacks. Yeah, they put them in jail. Oh well. In fact, one had the effrontery to go and to seek for employment in Covenant University. It's a quack. He went to do a fake certificate, do everything fake. Then went to Covenant University and then claimed that he's a doctor. He got 2-1 MBBS. I mean, the moment he said that, every doctor there knew that this is a quack. Because I mean, some things cannot happen. So we just know that okay, just sit down. Don't call police. Now they are asking him questions. Don't call police. That guy is a quack. And carry him to police station. Quacks should just be summarily executed. Because there is no purpose. You see, if you are in an aeroplane and you are not a pilot, what is your intention?
To kill people now.
So what is your intention when you took that person to theater and you are not a doctor and you know you are not certified to, and you know you don't know what to do, and then you now
And I also think there is the poverty angle as well.
why will you
not that. There's the point I'm trying to make, that there are some hospitals where there is a doctor qualified and everything, but because he probably doesn't want to employ people that are qualified,
you now
he
get an
gets
auxiliary doctor,
apprentices
and then
who
he
would
trains those
learn.
ones.
He trains, and I think that's also very common.
Those kind of doctors too should be followed. So those are murder too, second degree murder.
Especially in some areas, in some rural areas and slums, those are very common. Like there will be
a doctor.
In fact, senior doctor who probably works in one of these teaching hospitals.
You go to a federal government,
Yes.
government hospital. Is
Yes.
the one that is signaling the town with his image.
Yes.
He's remaking the whole town in his image, Abi,
Yes.
and then bringing quacks everywhere, and then those quacks will now send him It is government's problem. Half of all Nigerian doctors have traveled abroad. Why? To seek for greener pastures. Half of those that have gone abroad over there will never practice medicine. I say it again. Half of those Nigerian doctors that traveled abroad will never practice medicine. They will do something else. They will drive cab. They will drive.
But they write this exam before
They
going.
can write anything that you want to write. It's not as if they are going to give you a job. They shall more graduate or more. Don't they have kids that are graduating as doctors there?
In fact, I saw a report of those who traveled. They were sponsored on healthcare jobs and everything. They got stranded because the jobs are not even there.
They cannot give you the jobs there because they regulate their government is the regulator.
Yes.
If government can decide, you see, how many consultants are every local government in Nigeria is entitled to one comprehensive hospital. The comprehensive hospital for Ibadan, I don't know which local government it will be in. It will be in Adeoyo.
Yeah.
It's not for the whole Ibadan. It's just for one local government. Other areas, both
There's one in the hospital management board in Jericho.
yes, that one will be for another
Yes.
Jericho General. They call the General Hospital Jericho, apart from the specialist hospital.
Yes.
Every local government, so your state should have minimum 33 comprehensive health centers.
And then
primary health centers should be in every ward. Wards. Where you vote. Yes, where you vote.
They are there.
Everywhere you vote, there's a ward. Everywhere you vote, there must be a primary health center. Ward, a primary school. That is what it works. And you see, government must run it down the line. Health is not on exclusive, it's a concurrent list. So the primary local government, is it primary local government?
Primary healthcare is local government.
The primary healthcare goes to local government.
Yes.
The primary school goes to local government. The secondary healthcare goes to state government. The secondary schools go to state government. The federal cares go to federal government. So the federal universities go to federal government. States that decide to say we want to be above so
the fact that the primary care centers, the general hospital are not there, that's why usage is overburdened, for instance.
Usually, by statistics of WHO, 85% of every population, 85 of every 100 will only need to visit a primary healthcare center. That is where their health problems will be solved. All 85%.
That's like
so now remaining 15. Of the 15 that are left, 10 we have all their solutions given at secondary healthcare. Relieving 5 to go to UCH.
But so in this case, you have 90.
We treat malaria in UCH. And it tells you, when I see them coming and the only thing they have is malaria in UCH, I ask myself, and these people come together and they say,
so I want to go over this responsible drug use again. Your advice: go to a doctor.
Do not take any drug
without prescription.
And you see, the only thing that you're allowed to take without prescription are the things that nature gave free: air, water,
sleep,
food, sleep. All those for exercise. All those 5 are drugs. We can prescribe them. We do prescribe them.
Yeah, you need to rest.
You need to sleep. We can admit you
to sleep.
Admit for bed rest. That's what we call it. Yes. Admit for bed rest. This guy is just admitting for bed rest. Put him on the bed. Put him on water. Put something inside the water. Let him just calm down there. Leave him alone. That's what he needs. Yeah, we can do that. Food. Of course, we can. If you are not, we can put something in your nose to your stomach and put the food there to get to so that you can eat. We can put it through your vessel.
Yeah, you can recommend to drink more water.
We can say drink water. We can say stop drinking water. All the old people now we say drink water because you piss a lot. We say that. But that you are going to go and buy tablets or syrup or injection before you take that step, go and see a doctor first. Even if you think that you need multivite, it's not everybody that needs multivite. If you are eating good food, you don't need multivite. So don't be bothered.
So anything outside that is irresponsible drug use.
Pregnant, fresh mothers, newborn mother, you don't need to put drop in your baby's mouth. The only drop that must be in your baby's mouth is either breast milk or vaccination. When they vaccinate your baby, that's the only time they put something else. Even water, we don't ask women to give their babies water because the breast milk contains enough water for the baby. So feed the baby breast milk. You mother, to feed well, eat very well. If you eat very well, not drink ogi, not that you give birth and then you start drinking ogi. You start no, eat pounded yam amala, eat food. You drink lot of water, then go feed your baby breast milk. What we are having in Nigeria now is a scenario, and anytime you see anybody who comes to you and says that there is a wonder drug, there is no wonder drug. It's a lie.
No such thing.
If somebody comes and says there's a drug that can cure
hypertension,
no, one is on my Facebook. We are still arguing the matter. The guy he says he has a drug that can cure cataract and glaucoma, and a lot of people are already, I want to buy, all those nonsense, all those herbs and herbal. I'm not saying that they are not going to work, but before we admit unorthodox medicine into orthodox, we need to put the drugs through clinical trials. Yes. So we need to say, okay, you bring 100 people that have the disease. We will take 50 of them. We will give them the regulated drug, the normal drug that we'll be using to treat them. This is the drug. That's clinical trial. Yes. So you take one, you give 50, you give them the normal drug. So like diabetes now, we will give them maybe glimepiride or maybe all of those. And then this clown that has come out to say that he has developed a new drug, we say, okay, take your own drug, give the other 50. Every 2 days, we will check. We will check the blood sugar. We will check the blood sugar. We will check the blood sugar. By the time we check the blood sugar, we will be able to see it. It's going to be, in 1 week, we will clear it. We will say, no, wait. This one's sugar is settled. These ones are not settled. So this one is not working. Don't need to push the thing beyond the boundary of propriety. That's how you do clinical trial. In clinical trial, you must establish that your drug is at worst equal to the one that we are selling in the market. At worst. The best is for the drug to be better than what is occurring in the market.
Not worse.
Not to even now say that NAFDAC will approve without a clinical trial. And then the only thing that NAFDAC can come out to say is that the approval had expired. So if the approval had not expired,
what would happen?
What would happen? Anyway, the government's part.
Yeah. Thank you so much, Dr. Obasa, for joining us. I mean, as I said, anytime doctor comes in here, you start thinking about life again. Well, thank you. We're back next Thursday on Dr. The House, midday as usual on the Beat 97.9 FM. Bye for now.